Hello everyone, I'm Dr. Matthew Reedy with Trillium Creek Dermatology, coming to you today with my colleague Dr. Wyatt Andrasik and our founder and medical director Dr. Helen Torok. Today we have a few topics we're going to be discussing, but before we get started I'd like to introduce our practice. So Dr. Torok started this practice many years ago and it's grown over the years. We now have 5 locations. We're currently in Medina, but we also have offices in Worcester, Wadsworth, Brunswick, and our newest office is Strongsville. She's built a large team. We have a lot of MDs, we have many physician assistants who are wonderful, we have a Mohs micrographic surgeon with Dr. Bayless. So the team is large, and with this large team, we all work together. We're very well trained in complex medical dermatology. We see adult patients, we see pediatrics. We also have great options for cosmetics for patients. So she's really built a comprehensive skincare center, and I think Dr. Leonard and Dr. Helen both really prioritize staying up to date with medical technology. We have the newest lasers, the newest medical devices, which gives us as providers a lot of options for our patients. And as a patient, it's really a one-stop shop. You have all the tools here, and we really strive to help you meet your skincare needs. So if you need to see us, stop by at any of our 5 locations, visit us online at tcohio.com, or if you want to call and schedule an appointment, it's 330-725-0569. We're going to jump right into the first topic. So the first topic is skin cancer, and unfortunately, very, very common. We all see several cases every day in practice, and we know sun protection is critical for preventing skin cancer. But we also know if you catch skin cancer early, the prognosis can be excellent. It's very treatable. So at Trillium Creek, we are offering skin cancer screening promotions. And why don't we start with Dr. Helen Torok? Could you tell us a little bit about these skin cancer screening promotions?
So this has been one of the most successful programs that we've ever launched in our practice. Why? Because skin cancer awareness is really now something that everybody looks at, right? Everybody's aware that they can get skin cancers, even children, thank goodness, our teenagers especially, with all their tanning beds. But we do preventative screenings, and those are, we offer those usually in the winter months. The preventative screenings are done by all of our providers, so you can get it anytime you can. You can do it online, you can call, but that's one of our most popular programs at our practice.
Exactly. Dr. Andrasik, say a patient comes in for one of these skin cancer screenings, you're doing the check, you see a lesion, you see a mole that looks suspicious. What can a patient expect for the next steps?
So at that point we would consider doing a biopsy, and a biopsy can take on several different forms. So depending on the type of tumor, we may do what's called a shave biopsy, where we numb up the skin, take a shave that's flat with the skin, and send it off. We may also do a punch biopsy if we want to try to get a little bit more depth with our biopsy, and we take what's called like a cookie cutter tool, numb up the skin again, take the piece of skin out and send it off. Even some lesions, depending on how concerned we are with it, may be okay to monitor. So we may take pictures with our iPads and even with our dermatoscopes to get a real in-depth view of that lesion, measure it, and then check back in on it, usually like 3 to 6 months, to see if it's changed, because we know that in general skin cancers will change over time, and so if we do see that change, we end up doing a biopsy.
Exactly, yep. And to add to that, when you come in for your skin cancer screenings, we check you head to toe, we look for anything that looks like cancer. But I know all of our providers, we also really try to educate our patients during these screenings. So we check you, but we're also trying to teach while we're doing it. And we want to teach you, preventative measures, wear sunscreen, wear SPF 30 and above, stick to mineral-based sunscreen that has zinc oxide or titanium dioxide, wear sun protective clothing, hats, sunglasses. And then we also try to point out common signs of skin cancer, things to look out for. So like he mentioned, if a lesion is changing, if it's growing in size, changing shape, color, bleeding, scabbing, not healing, these are all red flags. But I always also mention, it's important to check yourself, but melanoma, for example, the most dangerous skin cancer that we see on a daily basis. On men, a lot of times it occurs on the back.
Yeah.
It's impossible. I try to check my back, it's hard. It's hard to do. And for a patient who's not trained, if you're trying to check your back, it's hard to know what to look out for. So I always say, check yourself, yes, it's important, but also just get in for these screenings, see a professional, let them check you head to toe, let them check your back, and just make sure everything's safe.
The one important thing that is if you're a female and you're applying your sunblocks, I do tell my women to use a tinted sunblock. The tinted sunblocks has iron oxide in it, which I think is the third most best mineral that you can add to your sunblocks. Obviously, men are not going to use a tinted because it looks like a foundation, but in women, they just love it because you've got your foundation, which is your base, in your females, and then you've got your sunblock. And I always tell them 40 or higher for females. The iron oxide gives them that 40. Yeah.
Also important, I think, for those females who get pigment or melasma.
Yeah.
I think that iron oxide is important.
It is really important, yeah.
Yeah, it can help protect you against the fluorescent lights as well.
Yeah.
All these lights here, right?
Yeah. All great points.
Yeah.
How often would you recommend for a patient to have one of these skin cancer screenings?
So it's very important depending on their history. If they have a very strong family history and they've had skin cancer themselves, twice a year would be recommended, every 6 months. Most patients who don't have any skin cancers, once a year is, I think, mandatory, over 40, 50. That's what I tell my patients. My youngest patient that I ever saw was 14 with a basal cell, a female, right smack dab in the forehead. So it's not just age-related, it is family, genetics, what is it, have they abused the tanning beds as teenagers? 2 bad sunburns increases your risk for skin cancers. If you've had a melanoma, every 3-4 months, sometimes depending on the depth of the melanoma is what we recommend. So it is all dependent on genetics, family history, and your own history of skin cancers.
I think the genetics is a good point because obviously we know our most common forms of skin cancer are induced by the sun, but we do have some skin cancers that are purely genetic, especially melanomas. I'll have some patients that come in and say, well, I haven't been out in the sun since I was a kid. I've protected my skin since I've been an adult. But really that sun exposure from when you were born, until you're a young adult, those changes, the damages to the skin from the sunburns can manifest as skin cancers later on in life.
Yeah. They think they're invincible though. At that age. It's a problem.
Exactly.
Yeah.
Very true.
Yeah.
Well, very good. That concludes the first topic. I think we're going to move on to our next topic. The next topic is talking about winter weather and the dermatologic conditions we see. And this is the perfect day to discuss this. Currently, we are January 2025 in Ohio, Northeast Ohio. It is below zero. Most of the schools in Medina County are closed due to the cold weather. My son is sleeping right now at home. He doesn't have to go to school. I am jealous. But yes, it's perfect time to talk about this. So Dr. Andrasik, why don't we start with you?
Sure.
With the really cold winter weather, what skin conditions are you seeing and what tips do you have for our patients?
Yeah, so probably the most common one is eczema or atopic dermatitis. We see that when the heat comes on, we lose water through our skin, and so that heat really draws the water out of our skin, it dries it out. And when you dry out the skin barrier is not as good. And so things that we use in our everyday products, like our personal care products that include body washes, detergents, that contain fragrances and preservatives, those can get into the skin easier and cause an inflammatory reaction.
Yeah.
We also see cheilitis or chapped lips as a common one. Some people will also have flares of their psoriasis during the winter, and I think part of that is linked to the wintertime infections are going around, people are sick, and that can definitely trigger a flare of psoriasis.
Completely agree, yes. I'm seeing psoriasis, I'm seeing eczema flaring right now, and a lot of my patients, their skin is very inflamed, it's challenging to control at this point in the year. And some of our patients, especially the ones who are retired, will leave Ohio after the holidays. They'll head south to Florida and they stay there for a few months and they tell me, my skin clears up in Florida, it's wonderful, my eczema is gone. I come back to Ohio in March and boom, there it is again. I'm sure you've heard this
all the time.
So it's very obvious that weather does play a factor. Dr. Torok, for patients when it's very cold, do you have any tips, things they should avoid to help their skin?
Well, the common things that we recommend, and most people know this, don't take long hot showers, right? Which really feels good in the morning, like this morning, right?
Yes.
Oh, warm up, loosen up, right? But those just dehydrate you more, you know? Everybody in January starts what, their New Year's resolutions, right? So what are they doing? They're going to the gyms, right? They're in the hot tubs, they're in the showers, they're just sweating, and they're drier and drier. So as soon as you take that shower, or whatever, your bath, hydrate, moisturize, trap the moisture in your skin, trap that water in your skin. And the one product that really traps things into your skin is Vaseline. It's greasy, right? It's okay on the face, but to put it on your body, it's a little greasy. So use moisturizing creams, not lotions. They're loaded with glycerin, a little bit of wax in there, minerals, and a little bit of Vaseline, but not a lot. And that is a very good vehicle, is a cream vehicle, all right? Yeah.
Yes, all good points. Something I think is important for our patients to know, a lot of them with their eczema, their dermatitis, their psoriasis during summer months, it's not very bad. You can manage with your topical medicine, with a cream. I think it's important though for patients to know it flares in winter. A lot of times the cream, the prescription cream you have isn't enough. And today in dermatology, it's a wonderful time to be practicing. We have so many new medications to treat eczema, to treat psoriasis. They're extremely safe, they're extremely effective, and patients should know you don't have to suffer through winter anymore. So if your eczema is not under control, your psoriasis isn't under control, no, we have pills that you can take now. We have shots that we can give you that are very safe. And some of my patients, I only put them on these pills or these shots in the winter, and then they ask if they can come off of them in the summer, and I'm always open to that idea. I always say patients have a say in their care, and if you want to come off of your medicine in the summer, I'm fine with it, but just know you don't have to suffer through winter. We have so many great options now, so come see us and we can talk about them.
I think it's an important point too is if you do start developing a rash or a dermatitis, to come in early and have it treated, because we know that these can really get out of hand, and they can get out of hand quickly. There's a condition called erythroderma where it's basically your eczema or your psoriasis that's covering more than 80% of your body, and that could be a medical emergency. So early treatment's always important.
Yeah, very good point.
Yeah, great point.
Yeah.
Perfect. Okay. I think we're going to move on to our next topic. Our final topic, we're going to be talking about acne, obviously a very common condition we all treat every day. Why don't we start with Dr. Torok? There are some misconceptions out there about acne. What are some of the common misconceptions that you hear on a daily basis?
So the most common thing is you see an older woman, right? 20s and 30s. I'm sorry, that's not older, that's young female. But they're over 20. Why am I getting acne at my age? Isn't acne just in teenagers? Isn't it just in my children? All right, that's a common misconception. The other thing is if I eat too much greasy food, that's gonna aggravate my acne or cause it because I've never had it before. The other thing is only oily skin people will get acne, which is not true, right? So those are some of the most common misconceptions. Also, the misconception is if I pop them, then I won't get any more, and I'm gonna heal them, and I can just do it with over-the-counter skincare. That's all wrong. Yeah.
I'm glad you brought up the point of diet and acne. I mean, we
huge.
get a lot of questions about that, right?
Yeah.
And we know from our medical studies that there are several things with the diet that can make acne worse. So we know diets that are high in dairy, diets that are high in sugar and whey protein can make acne worse. But sometimes we see patients with acne that aren't, eating a diet high in sugar or aren't taking whey protein, and it's not always the diet. I think sometimes that gets blown a little bit out of proportion with the media.
The other thing is the hormones. Those 20, 30-year-olds, even teenagers, they're on the wrong oral contraceptives, the wrong IUDs, intrauterine devices. They're all putting those in young females now. Those unfortunately will aggravate the acne and induce it.
I see that often. Also the Depo shot I've seen induce a lot of acne as well.
Yeah.
And sometimes I'll have a parent come in, their child's a new acne patient, and their parent is kind of opposed to medications and they just want to get to the root cause of the acne, which is always a challenge because there's so many causes. There's not one, it's not the fact that they're not washing their face enough. Yes, that can contribute, but that is not the only factor. Genetics play a role. As she mentioned, hormones play a role. Diet plays a role, your daily routine. So we can control so many we can do lifestyle modifications, we can really try to control the regimen throughout the day, but it's hard to control hormones, it's hard to control genetics. So a lot of times we have to combine lifestyle changes with some of our very good, very safe medications that we have.
I think genetics is really huge and important. I'm glad you brought that up because that is really important. You look at the mother or the father and say, have you ever had acne? Oh yeah, I was on Accutane. So if the parents had acne and were on Accutane, that child has a severe problem. They are very, very susceptible to getting the acne because of the genetic profile. Yeah,
absolutely.
So that's a good point. Yeah.
And for patients out there, I think it's important to know, yes, we can give you, a daily routine, some lifestyle changes to make. We have very good topical medicines available now. There are oral medications, we have several of them. We also have medical devices, like I mentioned earlier here at Trillium Creek, we have a laser called AeroLase that we can add to your topical medicine or we can add to your oral medication and that laser is very safe, really no downtime. And I've seen great results with it.
Yeah, I agree.
And then our very strong kind of big gun medication we have for acne is called Accutane, and Dr. Torok mentioned that. And Dr. Andrasik, I always hear parents are fearful when we mention Accutane. There is a stigma with the medicine. Can you speak to that a little bit?
Sure, yeah. I always like to counsel in depth about Accutane. I always tell them that it's our most effective treatment for acne. It's the closest thing we have to a cure for your acne, and when done in a medical setting is very safe. It's basically vitamin A in a pill, and what it does is shrink down the oil glands. There's a few things we have to make sure we're watching out in the patient's past medical history, make sure they don't have inflammatory bowel disease, or history of severe depression and things like that, but I would say that in most patients it's very safe, it's obviously very effective, and most patients are very happy when they're done with the course.
And the nice thing is it's only usually a 5-month course. And you can, in young men, especially the males, right, you can pretty much say, you're going to be clear. 90% of the patients will clear in 5 months.
Yeah.
And you won't need a repeat course, and you won't need anything further. Females are a little different because of the hormones, okay? So you then have to moderate the hormones and make sure it doesn't recur. Yeah.
Exactly, agree. And I oftentimes use that phrase as well. It's the closest thing to a cure that we have. And if it's dosed and monitored appropriately and you're seeing a provider who's comfortable prescribing it, it's extremely safe. In my opinion, safer than being on antibiotics for 3, 4, 5 years.
Yes.
Well, Accutane came out in 1987, right? I mean, I remember my very first patient I put on Accutane. Back then you did blood tests every month. Now it's, we're more comfortable with it. We know what to expect. To me, it is almost like a miracle. That's what I tell patients. It's just their quality of life, self-esteem just soars.
And like you said, I think it has come a long way. Oftentimes I'll see parents who are on Accutane and maybe had a bad experience. It was dosed too high or whatnot, but we know that a lot of the side effects are dose dependent. So I think that in general we've lowered the doses somewhat now to make it more tolerable for people.
Yeah.
And I completely agree with both of you. I agree, it is a miracle.
It truly is.
The before and after pictures are incredible. And I won't say always, I very often hear the phrase when I show those before and after pictures to the patient or their parent, I always hear, I wish we would have done it sooner.
Right.
Do you hear that?
Right, always. Oh, I don't remember it being that bad.
Yeah.
So the pictures are, what we always take because it just speaks volumes.
And Dr. Andrasik mentioned the issue with depression because a lot of patients and parents are worried about that. It's extremely, extremely rare. And there have been really large studies looking at thousands of patients who have been on the drug. And the general trend actually is that your mood often will improve on the medicine, which makes sense. Your skin is clearing, you're feeling more confident. And a lot of my Accutane patients, as I see them, their skin's clearing, they have a smile on their face,
a big smile.
They're more confident, they feel great.
Right. You look at the original picture there.
Right.
And then you see it halfway through there.
Exactly. That's so true.
It really is true.
It's great. I mean, studies have shown acne can cause depression and anxiety. It worsens the mood. So if we can clear it with Accutane or with Aerolase or with our topicals, patients are happier and more confident. So,
And you've made a difference in their life.
you have.
Huge difference. Huge difference.
Those are some of my favorite patients. The
Yeah.
ones who come in and are severely, cystic acne, or the patient's head to toe covered in psoriasis, and we can put them on Accutane and clear their acne, or we can put them on one of our biologics and clear their psoriasis. It's life changing. So those are some of my favorites, the most rewarding patients for me.
Exactly. Yeah. That's why we still do it every day.
Yep.
Yes, exactly. Well, very good. I think that concludes our discussion. Thank you all for being with us. Again, that's Dr. Wyatt Andrasik and Dr. Helen Torok. I'm Dr. Matthew Reedy with Trillium Creek Dermatology. Feel free to visit us online at tcohio.com. Give us a call, 330-725-0569. Thank you.
Thank you.